Everyone, I am Vidilaracy, Assistant Professor, Department of Pharmaceutical Analysis and Chemistry. Now I am currently working in Sri Shanmugha College of Pharmacy. Today we are discussing about the topic name is sulfonamides. First one, introduction of sulfonamides. Sulfonamides are group of synthetic antimicrobial agent that contain the sulfonamide group, means SO₂NH2. These drugs was the first antimicrobial agent widely used in clinical medication and way for the antibiotic revolution in the mid 20th century. Sulfonamides are bacteriostatic, meaning they inhibit the growth and multiplication of bacteria rather than directly killing them. Clinical uses. Sulfonamides are used to do variety of bacterial infections including urinary tract infections, respiratory tract infections, specific type of meningitis, some gastrointestinal infections, certain protozoal infections like toxoplasmosis and combined with the pyrimethamine. Next one, historical development of sulfonamides. First effective chemotherapeutic agents used for historical development of sulfonamides and systematically for the cure of bacterial infections in humans led to sharp decline in the morbidity and mortality of infectious disease that may be caused by antibacterial infections, means killing the microorganism or developing the microorganism. Antibacterial properties of the sulfonamides discovered in the mid 1930s. Protosyl dye was one of series of dyes examined by Gerhard Domack of Bayes of Germany. In the might be taken selectively by certain pathogenic bacteria and not by human cells. Protosyl rubrum converted into liver and hydrogen and next converted into sulfonamide. Nomenclature of the sulfonamides. The nomenclature of sulfonamide follows the rules of organic chemistry naming, specifically for sulfonamide compounds. The sulfonamide group, sulfur atom double bonded to two oxygen atoms and bonded to nitrogen atom, that in turn bonded to a hydrogen atom or organic group, forms the basis of this class of compounds. More detailed look at these drugs typically named sulfonamide, means NH2 double bond O, one benzene ring and next attached with NH2. This is called sulfonamide structure. Basic structure. The basic structure of sulfonamide can be represented as RSO₂NH2, where R represents an aromatic or heterocyclic ring to which the sulfonamide group is attached. The naming variety of complexity of the R group and any additional substitutions, means alkyl substitutions or aryl substitutions. Generic names. Most sulfonamides having generic names ending in sulf and followed by suffix. The names often reflect the structure, particularly the nature of the aromatic or heterocyclic group attached to the sulfonamide nitrogen. For example, sulfomethoxazole contains methoxic group attached to benzene ring at parts of R group. Sulfur isoxazole has been isoxazole ring is attached. Next one, systematic ring naming of sulfonamides. The systematic name of sulfonamide can be determined by identifying the base compound and any substituents. First one, identify the main sulfonamide structure, determine the aromatic or heterocyclic compound that the SO₂NH2 group is attached. Apply standard IUPAC nomenclature rules. Name and base aromatic or heterocyclic compound indicate the presence of SO₂NH2 by using prefix sulfonamide or sulfonamide attached to the name of the ring system. Numbering system of shows the position, sulfonamide group and any other substituents. Add substituents means name and number any additional substituents on the aromatic or heterocyclic ring using standard nomenclature rules. Next one, examples. Which one examples used for sulfonamide groups? First one, sulfur diazine. The systematic name is 4-amino N-pyrimidine 2-il benzene sulfonamides. Here, sulfonamide is attached to benzene ring which also contains pyrimidine 2-il group and amino group at positions 2 and 4. Silver sulfur diazine is next example. Chemical name is silver 1,4-aminophenyl sulfonil 2-pyrimidinylide indicating the presence of silver pyrimidinal group and sulfonamide linkage and aniline group. Aniline group means aminobenzene ring. Sulfonamide is a generic term that denotes the three different cases. First one, antibacterials that are aniline substituted sulfonamides, means sulfonamide. Prodrugs that react to generate active sulfonamides, example sulfasalazine. Non-aniline sulfonamides examples are mefenide acetate. Mechanism of action of sulfonamides. Sulfonamides inhibit the synthesis of dihydrofolic acid and precursor to folic acid for bacterial growth and replication. They achieve competitively inhibiting the enzyme dihydroderoate synthase, which is involved in incorporating of para-aminobenzoic acid, that means PABA, into dihydrofolic acid. Humans and other mammals synthesize their own folic acid, but instead through their diet, pathway of inhibition specifically targeted into bacteria, which makes sulfonamides selectively in their actions. Next one, mechanism of action with including side effects. Sulfonamides are generally well tolerated and cause a range of side effects including allergic reactions such as skin rash and Stevens-Jones syndrome, gastrointestinal disturbances like nausea and vomiting, hematological changes such as hemolytic anemia, particularly in patients with G6PD deficiency. Next one, spectrum activity of sulfonamides. Spectrum activity of sulfonamide means it inhibits the gram-positive and gram-negative bacteria, means Nocardia, Chlamydia trachomatis and some protozoa. Some enteric bacteria such as E. coli, Salmonella and Enterobacter species inhibited. Sulfonamides are frequently used as single agents. Many strains of one's susceptible species including meningococci, pneumococci, streptococci, staphylococci and conococcus are now resistant. It is useful for urinary tract infections, may be used in the sulfonamide, and excreted by high excretion and fraction of through the kidneys. Thank you.